Welcome to this installment of the EMR instructional videos, A Curo Virtual Chart. This video was developed by the WRHA CSIS team in coordination with EMR users. This video is meant as reference material regarding the functionality of the EMR. Examples provided during this demonstration cover various workflows and should not replace any on-the-job instruction provided by on-site supervisors, managers, or directors. During this demonstration, the following topics will be covered: virtual chart headers, filtering and searching within the virtual chart, F3 quick function key. Essentially, the virtual chart is a table. In order to effectively find items in the table, it is important to understand the table headers. Date. This identifies either the created date of the item or the assigned date if viewing the PDF documents. The I column is used to assign faxing or printing icons to those items that have been faxed or printed from within the EMR. This also alerts users to abnormal lab results using the red circle with white exclamation mark. Type is the broad category identifier for each item. Note. Note contains the brief description or title attached to an item by the user prior to saving to the client record. Provider identifies the provider associated with the item or the assigned reviewer. Reviewed will populate with a date if it has been reviewed. These column headers can be sorted for easier searching. To sort the items, select the column you would like to sort by. For this example, I will sort by date. A Curo sorts either numerically or alphabetically depending on the column. The columns can also be sorted in ascending or descending order. By clicking again on the header, notice it switches to sorting in descending order. From is only acceptable to PDF documents or results if the description has been included during admin processing of incoming faxed or scanned documents. The majority of the EMR site users are not populating this field today, but could begin to populate in the future. Please check with your site to determine if you should have information within this column. There is also the ability to filter to a specific item type within the virtual chart. Filtering is managed by the side panel. We can first filter by the associated providers in the clinic. Please note, if the client chart is also being used by another site provider, you will not be able to filter by their name. Only providers at your site will appear in this drop-down. In these situations where the item you seek is not created by a user from your site, it is beneficial to filter by the type and then sort the provider column. To return my search to all providers, I will select the All option, returning each item available on the client record. To filter by the item type, select the type of interest. Clinical Notes contains all provider-authored notes. Forms contains all the requisition assessments and referral forms created for the client from within the EMR. Lab lists results that have been received electronically via the lab interface. Documents lists imported electronic documents associated with the patient's chart. A few examples include consult letters, x-rays, or general documents. Generated letters. This provides access to a copy of the original letter that was created and either printed from the EMR or faxed directly to their recipients. Tasks. This lists the tasks that have been sent or received specific to the client. Notes are the admin-related notes that have been saved to the client chart. This type also includes any saved mail messages. Diagnoses is a linking tool. Any item that has a diagnostic link can be filtered when selecting the specific diagnoses. Only those items associated with the diagnoses are visible, allowing for quicker retrieval based on a client's conditions. Some of the filters also allow for subfolder viewing. For example, the clinical notes filter. If selecting the plus symbol, it will expand the two folders, clinical notes versus letters. Expand the clinical notes folder and it displays the note titles added by providers. This filter can be used to find a specific type of note very quickly. For example, I can easily retrieve my notes on diabetes consults. Similar expansion is accessible with form, documents, and labs. If wishing to permanently filter items from the virtual chart, use the top filter options. Removing the check marks will eliminate the item from your view regardless of the side panel filters. For example, if I remove the check mark from the patient notes, this will remove these from my virtual chart view. These settings will be saved for your virtual chart even if you log into another client record. If just starting out using the virtual chart, we encourage users to retain these check marks as removing them during your learning phase may contribute to missing items within the chart. You can also filter the virtual chart by date, which is very useful if the client has been attending a program for a number of years and you are searching for an item within the last year. The virtual chart also allows for searching using target words from the patient chart. This search field only works for words added to the EMR in either a clinical note, patient note, or letter. It will not display any PDF items. The overall purpose of the EMR virtual chart is to find items quickly. It also gives you the ability to display items in a larger window. To view, double-click on the item of interest. If viewing clinical notes, you will have access to any other notes within this window by using the navigational arrows. Moving between the number of notes using either the left or right side arrow. Double-clicking on the document items not only allows for viewing the document, but also allows you to update the document description if required. Once you close the document, the description will remain. Additional documents found on the client record can be viewed using the similar navigational arrows seen within the encounter notes. The purpose of the virtual chart is to act as a quick find tool. Akiro has also built in a quick function key, the F3 function key. To demonstrate, I will move into the scheduler section. The situation encountered by an EMR user may be as follows. A client calls wanting an update on their X-ray results. The user from within the scheduler section can press the F3 key to view the chart, filter their view to documents, again to X-rays, and can determine if it has been added to the client record. As well, if it is present there, they will be able to tell the client if the physician or NP has had a chance to review the document yet. I hope you have found this module on the WRHA Community Akiro virtual chart helpful. For further questions or clarifications, please contact CSIS_support at wrha.mb.ca.